everyone, this is Margaret Manning with 60 and Me. This is the place where women over 60 come to be inspired. And my guest tonight is Nancy Parode. Nancy is a travel expert. She works for About.com and focuses on senior travel. And I'm really glad to have you here today, Nancy. Welcome.
Thanks.
Nancy, I love chatting with you about all kinds of topics related to travel. And there's one topic that kind of it goes between medicine and travel, and it's about medical tourism. We've had a lot of questions about this, and I'd like you to give us your thoughts. A lot of people, in different countries now are becoming more popular for basically going abroad and having medical treatment that you either think is less expensive or is going to be fun to recuperate, in a place like Brazil or India. So tell us what you think are the steps or the questions someone should ask themselves if they're thinking about it.
I think the first question you should ask yourself before you get on a plane and go somewhere to have a medical procedure done is, did I do enough research? Do I really know all the ins and outs of the procedure I'm going to have in the location I've chosen? And that, of course, people look at cost, but there are other aspects as well. What kind of license does your doctor have? What kind of accreditation does the hospital? There are international medical accreditation associations that go into the hospitals and make sure that that they've met internationally approved standards of hygiene, cleanliness, how they handle the medical. Another important aspect of what about rehab after my procedure? Will I do that in the hospital? Will I do it in a hotel? How will I get back and forth to have the doctor look at the incision if I'm having surgery? And then do I need to bring some of my own supplies with me? Because medical care in various countries is handled differently. And where I live in the United States, the hospital provides everything. Of course, it costs. Everything costs something. But you don't have to bring anything except, your toothbrush and your hairbrush. Right. But that's not true in every country. In some countries, you're supposed to bring more supplies than we would where I live. So you need to know that in advance so you know what to pack. There's nothing wrong with that approach, but you need to be forewarned.
Right. So I think that good research is absolutely the number one question. And you've listed all the things. And also I was thinking about insurance, thinking about what your insurance is going to cover. Just have the facts. Just be completely knowledgeable about the journey before you sign the contract. And then travel. So
hopefully there is a contract so that you know what you're doing.
Well, and that's another thing. So what's the next thing that you do once you've decided that you've done enough research that you're gonna do it?
Right.
What's
next?
And
then I think you do need to discuss what your plans are with your own doctor. If your doctor doesn't approve, that doesn't mean that you shouldn't do it necessarily, but you're going to come back home and still have a professional relationship with that doctor. So you really want to kind of let him or her know in advance, I'm going to go have this surgery done here because it's so much cheaper. When I get home, things are going to be a little different than when I left. And so I'm going to bring all the paperwork home and, have a conversation with your doctor. And hopefully your doctor will give you some insight on what to expect at that procedure if it's a surgical one, what rehab should be like for you and when to perhaps call home if you have questions.
So Nancy, do you think in your experience, and maybe, you're not a medical practitioner, so you might not know, but do you think that most doctors are more open to medical tourism now and would not immediately dismiss it out of hand and try to put you off the idea?
Well, I don't have personal experience with this, but, most doctors understand the aspect of cost that some of their patients are really struggling to make ends meet and are trying to find good ways to save money on necessary medical procedures. I am from California originally, and I know that a lot of people in Southern California cross the board to have dental work done and things like that because it's so much less expensive. And, I've never heard of anybody telling people, my dentist had a fit because I had a crown done it, because it costs so much money. So, and besides, it seems to me that if your doctor gets all up in arms, that's your body, but you need to make informed decisions. And I think doctor should be part of that making process.
Okay. So that's great. So you've got done your research, you've consulted with your doctor. Now you're going to Brazil. And you don't
Right.
speak Portuguese.
And you don't speak Portuguese. Exactly. And you don't have friends who speak Portuguese who can help you. So how are you going to deal with the language barrier is another important consideration, especially if you go to some place where you don't even know the alphabet. I've lived in a couple of countries that are not my native country, and I know firsthand that it can be very scary to know that you need help and not know how to ask for it.
Yes.
So
Yes.
my suggestion would be to learn some words and phrases and spend some time writing down some vocabulary pertaining to what you're trying to do. If you're going to have a dental procedure done,
Right.
my tooth hurts would be a really good thing to know how to say.
Or not, don't hurt me.
Yes. And
Or that
also
hurts.
basic things like things you're allergic to,
Yes.
things bother, please call my daughter, so that you have some way to at least point to a card or attempt to express yourself, because you can't guarantee that everyone who walks into your hospital room is going to speak your language when you've gone to their country. So it's up to
Yeah, no, that's a
you.
really great idea, Nancy. And also, there are a lot of online free language services now, like Duolingo is one that we talk
Right.
about a lot, and Babbel. You can go online pretty much, well, free or a very small monthly charge and learn. You could take 2 or 3
Right.
months. You'd be able to talk, no, not fluently, but enough to get her understood, to be understood. Cool. Okay, so what else have we got to think about?
If you're having a major procedure done, it would be really good to have someone with you. Just because for example, if you were having a knee replaced, you have an automatic mobility issue and you might not be able to get back and forth to the doctor's office or the hospital while you're still there recuperating. So sometimes it's nice to have someone available to you would want someone to come in and maybe, get you some food or whatever when you're at
Like
home.
your cat, I think, wants you to get them some food.
I already did. This
I
is
could
a
hear
big
your kitty in the
boy.
background. I
Sorry
think we
about
had
Pooh
no.
Bear.
I think we had her on your lap last time, but
Yeah, we did.
it's all good.
Yeah, it's just a big, I want to blow. Anyway, but if you don't have someone who can come with you, there are also medical concierge companies and medical tourism companies that offer some services like this. So you can pay to have someone check in with you or to be there while you are having the surgery. It's not quite the same as having someone well, but it's someone, and sometimes that someone can make a difference in your recovery process.
And I think the other thing we talked about before is having a plan if something goes wrong. I mean,
Yes.
it's a medical procedure. Even the best doctors in the world, something can happen. So
Right,
I guess having
right.
that as a plan is next, would you say?
Yes, it is. Have some kind of idea of what you will do if something goes terribly wrong. You get a huge infection in your incision and the doctors can't do anything about it. One of the best ways to prepare is to get enough travel insurance so that you can get home without it costing you literally an arm and a leg sometimes.
Yes.
There is such a thing as medical evacuation insurance, and you can buy it from a wide variety of travel insurance providers, and it will pay to fly you home so that you can be looked at in the hospital near your house. You can do that even if you're not a medical tourist. If you're just going on a trip, you can get this kind of coverage. But for medical tourism, I think it's really essential that you have a way to get home affordably and quickly if you need to. The travel insurance provider will help you set that up. And if something goes wrong, you call your insurance company and they start making the arrangements to get you home.
And so I guess at the end of the day, what you've just said about insurance and coverage and having someone come with you, you have to weigh up the cost and the risk with the convenience and the expertise of the service, I suppose. And it's a personal thing. But I hope we've given everyone a good idea of what they should be, at least a plan. And in the article that we're including with this video, you've listed all these things in a lot more detail. So please go and take a look at the article, read it through. And if you've got questions, Nancy works out at about.com, and Nancy Parode, you can find her there. And there's, of course, other experts too that can help you. But, just take this information and make a good decision. Have we missed anything, Nancy, that I should have mentioned?
No, I think we're good.
Good. Okay, great. Well, have fun in Brazil, everybody, having the teeth work done. No, I think there's some really great doctors around the world, and we should take this option seriously. So thanks a lot for all the great advice. Thanks,
You're
Nancy.
welcome.